What is going on, y'all? Travis here, back with another episode of Grey's Anatomy, Season 8, Episode 15. Let's get into it, shall we? We're cruising. We are cruising along here, people, with Season 8. Yes, we are.
We fight.
No, you yell and then you go silent.
Ooh.
I yell because we don't communicate. There's no intimacy.
There's intimacy.
Called her out about her baby in
All right,
front of a
there's
party
intimacy,
full of
but
people.
we're not on the same page.
Because I don't do
In
what
front
you
of a
want me
house
to do.
full of
Because
people.
you had an abortion.
We've done couples therapy before. He has PTSD
She's had it too.
from the shooting, but not at the same time. We didn't have it at the same time. And mine wasn't as bad as his is.
You lay on the floor of an OR.
You choked me
You quit being a doctor.
Oh,
for a little while, but now we're fine. Really?
Okay, we're fine.
I meant the PTSD.
Okay, yeah, we're fine.
I don't know about that. I feel like that's probably something you always have to deal with.
We're
But
fine.
Except for the part where you aborted the child that I wanted.
Except for the part where 4 months later you screamed, "I killed your baby" in front of all our friends.
boom,
When you've tried
that's
everything,
the one right
but
there.
that headache won't go away, you can't stop coughing, the swelling won't go down, that's when you turn to a professional. As surgeons, we spend years developing skills that allow us to see exactly what the problem is.
You haven't even looked.
I am telling you, it is unresectable.
I came all the way from Ellie to show you this. You could spend more than 30 seconds.
It's a gliosarcoma that has invaded the carotid artery.
Stop being a jackass.
That's the sister again?
She called you a jackass.
Dr. Gray, excuse us.
Dr. Gray, stay here. I need backup.
Fine. You just got out of rehab. I want you to get on your feet, but you can't help her.
Look at his face. His name is Mason. This gliosarcoma belongs to his mother, Erica. I don't know him that well, but he seems great. I do know his dad well. His name is Cooper, and he works with me. He is a good dad, which means he is the one who is going to have to tell Mason that his mom is dead. He doesn't have a mom anymore because we didn't do anything.
You tell Cooper you're sorry. You tried. Let it go. How was surgery?
Trouble is, all that time spent developing those skills of perception
She said
can
she's
leave
from
a person
LA,
with an
is it-
extremely narrow point of view.
Cooper,
And how are
Cooper?
you supposed to argue with someone who has science on their side?
65-year-old woman enters the ER in shock. Let's go.
I would take the patient straight to the OR, access the peritoneal cavity through a vertical midline incision.
You guys studying for the oral boards in the middle of the day?
Benefit of having a study buddy, you should get one.
My stupid study buddy's too busy trying to save her stupid marriage.
You know what's better than a study buddy? A study lackey. Check it. Hey, you. Brown-haired girl. You're up.
Trauma incident or a surgical situation?
You made your interns come up with study questions?
A 12-year-old boy fell off his bike, hitting his abdomen against the handlebars.
What is it?
Sloan 911.
If you want, we could,
I don't need help. I'm an excellent surgeon. Everybody knows it. To prove myself to anyone.
except to the American Board of Surgery.
Yeah, there's them.
You might be a bad test taker.
Meredith Grey.
No, not Gray. Yang, maybe.
Yang's a cowboy.
Kepner.
Kepner.
Not Kepner. Definitely not Gray. She spent all that time in neuro and suddenly she's chasing General. She's unfocused.
What are y'all talking about?
You're underestimating her. I think she'd surprise you.
She'd have to.
She will.
She'll have to come to me.
Why y'all acting so dark and weird and mysterious? What the
I
hell?
do an exploratory laparotomy. The patient's still crashing.
Yep.
I gotta crack open his chest.
Good morning, Chuck. And Karev and Dr. Peterson. It's always nice to see you and Pete.
So, Chuck's looking pretty good. Abdominal pain's decreased. I think it's a good time to schedule a gastroscopy.
Well, then you're in luck, Dr. Peterson, because I think that Karev would be an excellent supervisor for your first gastroscopy.
Megan, let's go schedule that gastroscopy.
It's Morgan.
What is?
My name.
Whatever, same difference.
No.
Carrie Rissler is my patient.
Two different
has
names.
been for 8 years. She was given 6 months to live. A mastectomy, oophorectomy, and risky
What's a
experimental
oophorectomy?
biologic. I managed to save her life. It is a miracle. And when I saw that my patient, my miracle, is undergoing a lymph node transfer without my knowledge,
Said she brought it to you a few months ago and you shot it down.
her extensive scarring makes her a poor candidate.
But then Avery suggested we do some angio studies on her arm.
This procedure has had outstanding results.
This could make it worse. It could even kill her.
That's not gonna happen.
But because you're not operating, not after I speak to my patient.
You paid me 911 to get yelled at?
So that you could help me convince Bailey we're doing the right thing here. You failed.
So what do we do now?
Well, let's hope Carrie's a little bit more persuasive than you are.
Dr. Weber suggested.
Here's how this is gonna work. I talk and you listen. You are here because you and your little pals are all freaked out about the oral board, so Weber suggested that Callie Torres might have a special study method, right? Mm-hmm. Callie Torres does have a study method, an excellent study method.
He is
Callie Torres'
so
study method has to
gorgeous.
be earned. He doesn't think that Meredith Grey has what it takes.
So I think Meredith Grey has what it takes.
You could only get one good IV in. For her sake, Meredith Grey had better hope she's right. Today's gonna be a grind. Excuse me, coming through. Excuse Excuse me?
A grind? Really?
It's a meat grinder. Like you were thinking it too.
I don't think you're supposed to put your hand in there, buddy.
You're looking good, bro.
You're lying, Tommy.
Don't worry, Dominic. We just gave you some drugs for the pain.
Okay.
What do you think, Dr. Torres? Is this an amputation?
I don't know, is it? No, you tell me, Dr. Gray. Does this look like an amputation to you?
Oh my God.
Yeah.
You can't. I need my hand. Tommy, don't let them take my...
Whoa, is he?
No, those are the drugs.
think
We
your
have to.
hand-
He's gonna cut off his arm? I mean,
No, this is a teaching hospital, Mike. I'm doing a thing. Gray, here's how it's gonna work if you want my help on the boards. You're gonna decide our course of action. You're gonna be the person that stands between Dominic and a hook for a hand. Are you in or are you out?
I already said amputation is our best option.
Book an arm. Fire up the bone saw. Let's move him out, people. Gray wants to amputate.
I have a finger here.
I knew that already, Dr. Gray.
No, a viable finger. Look at the cap refill.
Is that bad or good?
That's good.
All right, so what do you want to do?
I think we should take this thing off and see what's left. The longer his hand stays in there, the more we compromise his circulation. So let's call up to maintenance to get a sawzall. Fire and rescue has tools.
Better.
We dropped a couple grand on that thing. You can't trash it. Mike, how long is it gonna take you to get that thing apart?
I take it apart and then clean it every night.
Dr. Torres,
Can you do it in under 45 minutes?
Give or take.
Gray?
do I think it's okay to let a couple of civilians take apart the machine that's grinding their brother's hand? Let's do it.
Okay, screwdriver.
Make that two.
And then y'all are gonna
Hey, you
put it back
paced?
together and put
Look,
food back in it again?
and
Put
the
meat
disease
back in
carotid
it?
together. Run
Real
balloon
meat?
catheters in
Not
through the
human
femoral, place them in
hand
precise
meat?
position, inflate them to stop
Arm?
the blood flow, then feed a heparinized shunt into place and reestablish blood flow. And I have to do it in 90 seconds. Any more than that and she strokes out.
Is that even possible?
I would love to test it out. So don't we need to get Derek's approval? He loves to say no to me.
Maybe you should refrain from calling him a jackass.
I can't help it because he is one.
Maybe I should ask him.
Would you? He's in surgery, OR2.
You just called me down here so that I would go to Derek for you. Feel like it was my idea.
You're dead.
Aren't I good?
Amazing.
I do not want kids. He knew that.
I did not. Most people would have considered dropping a bomb like that before the wedding. That is when it would have been relevant.
Did you ask?
Proposed, and we were married like 12 hours later. So sue me. I was thinking of other things.
Who's the
I
doctor?
know the lymphedema is bad.
Sausages, not arms. I can't lift them. Oh, I'm in pain all the time.
I think we just need to be happy the cancer is gone. And look at the lymphedemas, the price we're paying.
The price I'm paying. Oh, look. You don't think I felt awful sneaking in here like a thief? You saved my life.
How you carry that thing around?
You're a hero to me. I want to be able to brush my hair. Hold my grandson.
She was just starting college when you were first diagnosed.
I know. You promised me I'd make it to her graduation. If you really think this is a mistake, I won't do it.
What's your plan, Gray?
My plan is they get this thing off and then we assess.
So what if they don't? You need an alternate plan.
Don't need an alternate plan because they're gonna get it off.
What'd you do?
The more you guys loosen that, the more he's gonna bleed. Keep going, just go faster.
You sure you have time for that?
If you have something to suggest, why don't you?
No, well, his hand's still trapped in that grinder.
Let's get a pneumatic tourniquet on his arm above the grinder. That'll buy us a few minutes.
Hey.
I can give you guys 15 minutes, and after that, I have to amputate.
Understood.
We've operated on worse.
You showed us a picture of a little boy.
It's clear that she is passionate.
My sister's too emotionally wrapped up in this patient.
You know, it tells me that she's passionate enough to try harder.
And with all the passion in the world, we're not
stressed.
gonna make her plan doable in 90 seconds. You need to see that for yourself. Set it up.
You're going to be the one who sees a thing. I mean, thank you.
What?
Now, how can you do a gastroscopy and read the index cards? Keep them coming.
Congenital ganglionic megacolon, also known as
Hirschsprung's disease.
full treatment.
Did you skip symptoms?
Sorry.
Don't crap out on me now, Megan.
Morgan, symptoms severe and
She's about to
persistent
pass
tightness
out.
in chest, indigestion, blurred vision, shortness of breath,
Yeah, that's not Hirschsprung.
severe headache, nausea. Patient is 24 weeks pregnant.
You know what, that narrows it down. I'd order labs and a UA. Take her down to the OB. So she could be monitored.
Yeah, you should probably do that.
Hey, are you gonna just stand there or are you gonna help her? When were you gonna tell me you were pregnant?
Everybody in this hospital knows that I'm pregnant. They also know my name.
Baby looks fine. These are definitely not contractions.
List the symptoms.
I'm not quizzing you right now.
No, your symptom. Chest tightness.
Nausea, shortness of breath, indigestion.
Heartburn.
You mean like heartburn? Which cardio? You're having a heart attack.
There is no deeper reason. I wasn't
At least
abused.
you're already there.
I don't have a dark secret. I just don't want kids. People cannot want kids.
That's
It's a
true.
thing.
That is not a thing.
Yes, it is.
It's my thing.
There are plenty of people who do not want kids.
You're gonna change your mind.
Owen is.
In 3 years or 5, you're gonna change your mind about having a baby, and you're gonna regret it.
And I will know and understand that I made a choice.
There's also other ways.
I choose Medicine.
She might be older,
I
but
choose that over that I might one day regret not having a child. It's all right to never want kids. Some people don't ever want kids.
Why?
because they expensive, they stink. You always gotta pay attention to what they're
When she
doing.
started bleeding out. I had to tell her daughter Erin that she was in a coma and that there was a good chance she wouldn't wake up. She did. Still had 2 more surgeries ahead of her and radiation. Her body is a battlefield.
I get it. You talked her out of it.
No. You're doing the lymph node transfer without reading every page of this file twice.
But we're supposed to operate in half an hour.
Then start reading.
I love her.
I'm watching you, Avery.
Yes, ma'am.
Me too.
Come on.
BP's dropping, Gray.
You guys need to be done now.
Just one more.
Done.
We should be able to turn back the auger and pull him out.
It's time for you to go. Gray, take this. You've got the auger.
Oh my fucking god.
Look, can't we just stick around and see?
There we go.
Holy God.
We've got a piece of hand with sort of fingers on it.
What about these? Can these be saved?
I don't know. Can they?
Boom!
I would 100%
97 seconds.
pass out.
Bite me! Wow. Sorry. I've been at 97 seconds for 8 frickin' tries now.
Maybe not the ninth. If I can find another stopwatch.
I mean, Derek's probably right. I'm gonna let her down. You should know I've let him down enough times.
Let's take a break. You want to get something to eat?
I want something. It's not food.
Oh.
There was a guy who got his hand stuck in a meat grinder.
I wouldn't mind seeing that.
You had an acute MI from a spontaneous coronary artery dissection.
I don't have any other risk factor.
We need to get you upstairs right now.
Why are you here?
We need to repair the dissection
My
immediately.
baby's fine, right? My baby's fine. Why are you here?
All right, we need to go right now.
Too early to take the baby out. She could have hard ES or get septic.
We have to put you on bypass in order to fix it, so the baby needs to be delivered now.
24 weeks is premature, but there's a very good chance. You can't save it.
My baby was born at 23 weeks. I'll be here for you. We're all gonna be here.
Will someone call my boyfriend?
Karev, call her boyfriend and let him know what's happening.
I'm scrubbing in.
She's your intern, Karev.
Yeah, okay. Wait, her name's Megan, right?
Are you
name
fucking
is Morgan.
kidding me? Bro, he's irritating as fuck sometimes.
I wouldn't think you'd be thrown by a little thing like a severed finger.
Yeah, it smells like pork.
There she goes again. She's gonna yak.
Hey, where is your study lagging?
The one competent intern in the whole program just so happens to be pregnant. Surgery for a coronary artery dissection.
Morgan needs surgery?
How do you know?
Everybody knows about the pregnant intern crowd. There's my ride. Here we go.
If Morgan needs surgery, then why are you here?
Indian gave me a job. Call the boyfriend. I left 6 messages.
Chris is a 4th year. You know how busy it gets.
I didn't know his name.
They're not just amputating and fitting him for
Because
a
they
prosthetic.
actually care
She
about
thinks she's
people.
gonna be able to salvage
Karev.
the finger bits and reattach.
You know what else would be harder? Going through the carotid.
For fingers?
It would be harder, but there'd be better control than going through the femoral.
All right, come on. Here we go again. Just a few chunks. Oh, come on, just puke already.
That's a good-looking lymph node. You got it? Yeah.
Did he say oops?
Dr. Bailey, what a pleasant surprise.
He was
Let's
just
make some
studying.
room
How'd
so
you get
Dr.
in there?
Bailey can get a better view of our every move. As you were, Avery.
You don't want a little more suction?
Dr. Bailey, I'll instruct the resident.
But your instructions result in oops. We don't oops in my OR.
Let's try a little more suction.
You should at least listen to her.
I swear you gotta stop encouraging her.
You taught me to not give up until we've tried everything.
Because you can handle it. When we lose a patient, I know if you're okay or you're not because I'm right there with you. Her, I cannot do that because I don't think she can handle it.
You are the one who is too emotionally involved. If this tumor had come to you from any other doctor, you would still be looking at it. So worried about your sister's outcome that you won't even think about her patients. Am I wrong?
You have to try.
I am. I'm trying.
You're supposed to focus on each other and breathe, and you're not.
So now you know my every thought and intention?
We used to be able to look at each other, and I'd feel like we were going to be okay. There is a reason we're married. Please, look at me.
All right, I'm looking at you. Right now. I'm looking right at you.
He has to stop holding a grudge. He has to see me for who I am. Take his little list of all my crimes and rip it up. Otherwise
what? How about you stop thinking that you're the sun? I revolve around you, and maybe what I need is worthy of some consideration.
You two
And
aren't
we're back to
right
the
for each other.
abortion?
Yeah, we are.
I don't know if he'll ever be able to move past that.
Ready for the transfer, Avery.
Dr. Sloan, you know that this patient has a history of multiple surgeries in that area. I don't understand why you think it's a good idea to continue to dissect right there.
Entirely important that you understand everything I do.
I disagree. I think it's extremely important. If you had read file, like you said you did, she had massive scar tissue exactly in the area that you're dissecting. So I think going forward with that dissection is monumentally stupid.
The
bulk of that scar tissue is going to be found near her axilla. If Dr. Sloan continues right there, I really don't think there'll be a problem. I read that in the file that you gave me to read. I did read it. Damn it. Oh, we got a fake bleeder here.
Respectfully, I told you so.
Bailey, come on.
I think it'll work. If we cut down the macerated part of the finger, it'll be short, but it'll still be salvageable.
With this thumb, I'm gonna go ahead and say that's not salvageable. You're done here. He'll be better off with prosthetic.
No.
The thumb is responsible for 40% of hand function.
There's got to be something else. I read something about the surgeons using a man's big toe. Let's use this big toe.
Listen, Dr. Frankenstein, the big toe, it's pretty important for walking.
And he can learn to rebalance.
Or he can keep his toe where it is.
This is a good fix. I know it is.
No, it's not.
Dr. Torres, it has to be.
I would rather just
Big toe
probably have a
It's not
prosthetic.
the fix. That is why we're going to use the second toe. It'll provide the same benefits, but reduce potential disability.
Second toe's
Yeah, but we're not doing anything without the patient's consent.
thinner. That'd look like a funny thumb. My toe is not the same.
Tell me what you're trying to do.
Just give
I'm
me a
going in
fake
through the
one.
carotid. 2 catheters, one of the proximal.
Carotid stick? That'll kill her even faster. You can't stop and reestablish blood flow in 90 seconds.
The great god of neurosurgery has spoken.
Look, I'm trying to help you, but please don't put yourself through this. You're too fragile.
I am not fragile. I'm a drug addict. I've fallen off the wagon twice and I've gotten back on. That does not make you fragile. I am standing in a building full of pills right now. The fact that I am painfully aware of, but I am doing this. That is not fragile.
They kind of look alike, don't you think? They look like they could be brother and sister. I think it's the nose.
Okay. Show me what you're trying to do.
So you think there's a way?
No, I don't. But I can't stop you. So, I'm here with you. Show me what you're trying to do.
I was right. Right?
Too soon to tell.
Cut the crap, Torres. You two are gonna put a toe on a man's hand. That was her idea.
Maybe we are.
Are you serious?
Maybe we're not.
I'm sorry, I didn't mean to yell. That's weird.
Yeah, I feel you.
What if I say, okay, I get my hand back? Otherwise, you fit me for a hook?
A prosthetic. If you give the go-ahead.
He gets a hand.
Well, what are you looking at me for? Take my toe already. Take my left nut if it'll help.
I think the toe will be fine.
I was right.
This is how you're gonna spend your time now? Pulling strings behind the scenes like some kind of puppet master?
I am really good at it.
So I'm a 2-month-old baby. I'm underweight, fussy, I belch, and when I vomit, it hits the ceiling.
You have pyloric stenosis.
These cards are so detailed. Whose are these?
Those would be the smart ones. The only smart one. What the hell? What happened to Morgan's baby?
Morgan had her baby.
Oh, crap.
And one more clamp, please.
Well, is it subclavian?
Still oozing, Doctor. How do you want to proceed?
I don't know.
Oh, he did not just say, I don't know. Tell me what you see.
Staring straight at the defect.
I think we can repair this ourselves. Stick tie.
Hatchet.
It's a good thought. Get on that. Bobby.
Distracted here.
Let me give you one small piece of advice. There is anything, I mean anything, distracting you from helping your patient. You need to leave it outside.
Oh, respectfully,
This is your patient now. Yours.
Someone had better tell me what is going on.
Dr. Bailey, you need to leave this OR.
Excuse me?
My patient developed a subclavian bleed because we misjudged her adhesions. But I am now doing an arterioplasty, and you are making it more difficult by distracting me. You are compromising my ability to care for my patient.
Well, if you're telling me you can't send
I'm telling you, you need to get out. Now!
Oh, Dr. Sloan, if you let your resident speak to an attending this way.
Dr. Bailey, I believe Dr. Avery made it very clear. Leave the OR, or I'll have you removed.
I mean, I do love me some Bailey, but I'm sure it's hard for them to do their job.
Get out of the way! Oh, damn it!
Wait, is that for the Peterson baby?
The mother, it's not good.
Come on.
What the hell happened?
We were barely in the NICU before he suffered an intestinal perf scrub, and I need your extra hands.
Give me a minute.
Hello? Yeah, this is Dr. Alex Karev. Work with Morgan in Seattle. You're fourth year, right? She's still in surgery, but she's critical. So's the baby. You need to get on a plane right now.
Meredith and I do not do
I hope
everything
she's okay.
together.
Twisted sisters.
What do you expect?
She has a baby.
That doesn't mean I have to.
I don't see why not. It's like you're a teen.
Because she's
She
my
also
person.
didn't give birth to
I
the
should be
baby.
your person.
Be my person, Owen. Be my freaking person.
There might be a difference there.
Be my person.
I don't think either of y'all really want each other to be each other's person, though.
Not going to use a plantar incision.
You know, I just don't think you're right
And
for
I
each
have
other.
isolated a good draining vein. Is that it? You're not going to ask me if I'm sure?
Are you sure?
Yes.
Okay, then. You're impressive.
I am.
There's always been a lot of hype surrounding you, okay? Meredith Grey, ooh, child of Ellis, ooh, isn't she so special? You're tougher than I thought. I'm saying you're smart. I'm saying, okay, look, we've never been friends.
My favorite coffee
Mainly
cup.
because you thought I was a freak and you're blonde. And now you have a baby and I have a baby and we're both married and I don't know, I'm saying we're both alike. I'm saying I'll help you.
You're not a freak, and we can be friends.
I thought you kind of were.
Every morning, you are in my office at 4 a.m. and we work, Gray. If you don't show up, if you are late, I will kick your ass. We work, and you're gonna pass this test. You're gonna pass it hard.
4 a.m. 4 o'clock is a one time a day time, and that's in the PM.
And then inflate. You need to get yours in position faster.
Unless I gotta get up at 4 a.m. to tinkle.
You ready? Inflate.
Starting the clock. Let's move.
Mr. Price is awake and responsive, and the rest of the post-ops are done. What are you doing?
We needed 2 surgeons rolling the balloons. We've almost got it to 90 seconds.
You think it's gonna work?
It's one step, one step.
He doesn't think it's gonna work.
Well, we're gonna go down trying. That's all. Thank you. You can go.
I want to go down trying.
Great. Pick up the stopwatch.
Hey, little boy. I'm Dr. Robbins, and this is Dr. Karev. You've got a long road ahead of you, and your mom, too.
Oh, good.
How's she doing?
Morgan? I haven't checked.
Oh.
I ran a pregnant chick all over the hospital today. Made her quiz me on my stupid boards till she damn near died. I haven't even checked to see how she's doing. Apparently, I'm the only person in this hospital who didn't know she was pregnant because I'm too busy worrying about my own stupid damn self to learn my interns' freaking names. Doesn't matter if I pass those boards or not. I don't deserve that fellowship.
You know why I like you so much?
I honestly have no idea.
You remind me of me. Peds surgeons were vicious. We're the most hardcore surgeons in the hospital. When I was a resident, I was a full-on horror show. But that's what it takes to learn how to save tiny humans like this one. Yeah. Do me a favor. Learn your interns' freaking names.
We may not like it, but it really is important to stop every once in a while.
It's really
Get out
good
of
with
your
the
own
kids,
head
though.
and see the bigger picture.
I need a word with you about Avery.
Dr. Bailey, I have a patient.
They all have good and
He
bad
was
qualities.
Right. Avery, he was right. He's gonna be able
I don't
to
think
use
any
her.
of them are like perfect.
So, why did I say no?
You were being careful.
I've done groundbreaking work on her behalf.
You were a resident like Avery. You get more experience, you get more conservative.
That's what success buys you. You get happy and then you get scared. Don't want anything in life to change.
You're a grown-up, you're risk averse. Because you know risk has actual consequences. Why we keep residents around. They keep us fresh.
You telling me that I'm not young anymore?
I'm trying to tell you you've arrived.
Oh, okay.
Oh, you pull that crap in my OR again, I'll report you to the board.
It's fair.
Actually, finding out that you've been looking at things all wrong can be sort of liberating.
What happened?
You're fine. Almond, she did a kick-ass repair on you.
My baby. Where's my baby?
He's stable. That's the first thing.
He?
Oh, yeah, that's, I guess, the first thing. He's a boy, and he's stable.
What?
He's intubated. We're giving him endomethacin to treat his PDA. He had a spontaneous intestinal perf that we fixed. Robbins, she's observing him right now. Morgan, he's doing great right now. Robbins is watching him, and when she leaves, I'm gonna watch him. And you know, I talked to Chris, and he's on his way right now. Okay, so you know, I thought I'd just hang out here for a while with you.
He's sweet when he wants to be,
Chris
huh?
gets here. Leave it at that. If that's okay.
You're hanging out here because quiet. You need to study.
No way.
You should. I would.
And suddenly you see new potential, new possibilities where you'd never seen them before.
See the skinny little toe thumb.
We have blood flow.
86 seconds.
Call your patient.
And that's all fine when a hopeless situation suddenly looks good. Unfortunately,
I'm afraid our time is up.
I think their time is up.
sometimes it goes the other way.
I think y'all's time is up. I don't see them moving past that. Maybe they will. Maybe I'll be wrong. We'll see. I'm okay with it. I'm open to it. But I mean, I never really loved Owen and Christina together anyways. That was a really good episode, man. And all the outcomes seem to have been pretty good. Can you imagine that man with the hand in the meat grinder and now he has a toe on his hand? If my hand is in a meat grinder, just cut it off. Take the whole thing. I'll take a fake one. I'll take a hook. I don't know. I'm not trying to put a toe on my hand. I'm just trying to get that hand out the grinder as fast as possible and safely without ripping out any tendons or doing any more damage to the stuff above it. First of all, my hand would not be going in the meat grinder in the first place. There's that. You know why I love Alex Karev? Alex Karev is an asshole, yes. But he is actually very self-aware. He owns who he is. He knows he's a dick. He continues to be one. But then 9 out of 10 times, 9.5 out of 10 times, he does the right, he comes to the right thing. You know what I mean? It takes him a minute sometimes, but he gets there. And that's why I like him, because he owns who he is. He doesn't fake it, and he continues to be who he is authentically. And I can fuck with that. I can fuck with you, Alex Karev. You piss me off sometimes, but for the most part, I dig you. Let me know what y'all thought about this one. I'll see you on the next one. Goodbye.